Okay. Okay. So last thing I covered was movement of the head and neck. Okay. Now we're moving on to the trunk. Okay. So trunk. Okay. You can extend the trunk. So by leaning backwards, I'm actually extending. Okay. My trunk. Okay. Um, the trunk extension. Okay. There's only one big muscle group involved, and that's the erector spinae. So here is the erector spinae. Okay, the erector spinae. So here, 1, 2, 3, is actually 3 separate muscles. Okay, uh, so these 3 here. The mnemonic for it is "I love spine." Okay, but you're not responsible for these 3. Okay. The synergist, okay, is the quadratus lumborum here. Okay. All right. So I'm gonna skip the breathing muscles for a second. I'm gonna move forward to the abdominal wall first. Okay. So the opposite of extension is flexion. So the muscles of the abdominal wall, okay, are in the opposite position as the erector spinae. So they're going to do the flexion of the trunk. Okay. The abdominal wall has, okay, 3 flat muscle sheets. Okay. These muscle sheets go in different directions, and the going in different directions allow you to protect the wall a little bit better. Okay. And it also allows for different movements. Okay. Okay. So here, okay, are the 3 layers. Okay. The first layer here is the external oblique. Okay. The next layer, the second layer, the middle layer, has 2 muscles, the internal oblique and the rectus abdominis. Okay. The third layer is going to be the transverse abdominis. Okay. So the easy way to tell the internal oblique from the external oblique, the external goes this way. Okay. It's the same movement as if you're putting your hands in your pockets. The external runs this way. The internal runs that way. Okay. So external, internal. Okay. The rectus abdominis is here. Okay. And then the last thing is the wall, which is the transverse abdominis. So 3 layers. Okay. First layer, external. Second layer, either the rectus abdominis or internal oblique. And then the third layer, okay, the transverse abdominis. Okay. All right. There are 2 features of the abdominal muscles I want to point out. Okay. And that has some clinical relevance to it. First is this line down the middle right here. Okay, that line is called the linea alba. Okay, and it actually runs through all 3 layers. The clinical importance of that line is that it's white. If it's white, that means there's not a lot of blood going to it. Okay, so it is easy to cut straight down that line. Okay, your belly button's running that line, it's easy to cut straight down that line. The importance of it cutting down that line is, well, if I cut down that line, I'm not going to bleed out a lot. Okay, so if I need a quick way to get into the abdomen, you just go straight down that line. Okay, the other thing is this right here. The external oblique will wrap up into a aponeurosis. Aponeurosis is like a tendon that's been stretched out. Okay, but the aponeurosis of the internal oblique is weird in that it wraps itself up into this cord. Okay, this cord is called the inguinal ligament. Okay. The inguinal ligament will not be on the test. Okay. The linear elbow may be. The inguinal ligament will become really important when we talk about the digestive system or the reproductive system and hernias. Okay. 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 Breathing. How about breathing? Okay. So breathing. Okay. We use one big muscle when we breathe, and that's the diaphragm. Okay. The diaphragm is in between the thorax and the abdomen. Okay. When the diaphragm contracts, it flattens out. It allows you to suck air in. The other thing that allows you to suck air in is the external obliques or external intercostals. Okay. So the diaphragm pulls down, the intercostals move up. The diaphragm pulls down, the intercostals move up. And so you open up your rib cage. And you open up your rib cage, the air comes rushing into the rib cage, okay, into the lungs. Okay, that's how you breathe in. When you breathe out, you just relax those muscles and air naturally pushes out. Well, I purposely want to blow, okay, like force air out if I was like blowing up a balloon, okay. I will also use my internal intercostals. My internal intercostals push down on my ribs to push more air out, okay. Again, the internal and external intercostals are hard to tell apart from each other, but you do the same thing. The external intercostals go this way, okay, the internal intercostals go that way, okay. External intercostals go this way, internal intercostals go that way. Okay. Oops. Okay. So we'll skip the pelvic floor. Okay, the muscle compartments of the limbs. Okay. Okay. Second. Okay, the limbs are slightly different because you have dense fibrous tissue dividing the limb muscles into compartments. Okay, so the muscles in the same compartment will have similar actions and act as synergists to each other usually. The muscles in opposite compartments are going to be antagonists. Okay, each compartment is innervated by a single nerve. Don't worry about the nerve right now. We'll cover the nerves in the next module. Okay. Okay, the upper limb. Okay, the extensors are on the posterior side. The flexors on the anterior side. The lower limb, because it rotates, the extensors are actually on the anterior side. The flexors are on the posterior side. Okay, so here. Okay. Okay, so here, the flexors are anterior side, the extensors on the posterior side. Leg is opposite. Okay. On the thigh and the leg is opposite. Okay. Okay. The upper limb, okay, has anterior compartments and posterior compartments. Okay. The anterior arm controls the shoulder. Okay. Anterior arm muscles flex the shoulder or arm. okay? And the innervation is the musculocutaneous. The anterior forearm muscles, okay, flex the wrist and digits. Okay, okay, so you see that here, okay? So two compartments. The dark red compartment is the anterior compartment, the pink compartment is the posterior compartment. Okay. Yeah. And here you see the anterior forearm here, okay? The flexors on the front, the extensors on the back. All right, so now let's look at the shoulder, okay? The movements of the scapula, pectoralis major, pectoralis minor, serratus anterior, and subclavius. Okay, so the first three you're responsible for, subclavius you're not. Okay, so pectoralis major is right there. Its movements are anything toward the front of the, like anything anterior. Okay, the synergist to that is the pectoralis major. Okay, also involved is the deltoid. Okay, here, the last one, serratus anterior. Okay, serratus anterior helps move the scapula forward. Okay, it's used in protraction of the scapula. The better way of explaining this is it is literally called the boxer's muscle. Because if I was throwing a punch, to throw a really hard punch, I would actually have to move my scapula forward. And to move the scapula forward, I use my serratus anterior. So if you look at like boxers or MMA fighters, all of them have really well developed serratus anterior. Okay. All right. Also, little muscles that help. This little one here, the coracobrachialis. Okay. Okay. All right, the movements of the scapula on the posterior side, trapezius, levator scapulae, rhomboid major, rhomboid minor. Okay. So that muscle is the trapezius. The trapezius is never a prime mover for anything. It's always a synergist for everything, because it's so broad and the fibers go in so many different angles. You can make it do just about anything. Okay, but since it's so thin, it doesn't do very much. It's never the prime mover. Okay, so that's the trapezius. That right there is the rhomboids. Okay, rhomboid major, rhomboid minor. What they do is they bring the two scapulas closer together. Okay, so if you're moving your arms back, they actually move the muscles back together. Okay, now this is the levator scapulae. Okay, and it does exactly what it sounds like it does. It elevates the scapula. Okay, all right, I want to take this time to point out the rotator cuff muscles as well. Okay, they do the little rotations of the scapula. Okay, so supraspinatus sits in the supraspinous fossa. So supraspinatus, infraspinatus sits in the infraspinous fossa. You have your teres minor. Okay, and last but not least, you have your subscapularis, which sits in the subscapular fossa. Okay, and the acronym is SITS, S-I-T-S, supraspinatus, infraspinatus, teres minor, and subscapularis. Okay, teres major is not a member of the rotator cuff. Okay, all right. All right, the major movements of the arm. okay, the deltoid and the pectoralis major. Okay, deltoid, pectoralis major. Okay, the deltoid allows you to abduct your arm. Okay, the pectoralis major allows you to flex your arm. Okay, this is arm flexion. Okay, so this is forearm flexion. This is arm flexion. Don't screw that up. Okay, all right. Does that, hopefully that makes sense. Okay, on the back side, you have this muscle right here, the latissimus dorsi. Okay. Okay, and here you can see the rotator cuff muscles even better. Supraspinatus, infraspinatus, teres minor. Okay. Okay. Now, so the shoulder is actually controlled by the muscles on the thorax. Okay, the muscles of the arm control the forearm. Okay, so you have muscles crossing the elbow joint. So on the posterior side, you'll have one muscle that you're responsible for, and that's the triceps. Okay, on the anterior side, you have the biceps brachii. Okay, the other thing the biceps brachii does is also to supinate the arm, the forearm. Okay, the brachialis and brachioradialis. Let me show you what all those muscles are. Okay, biceps brachii. Underneath it, the bigger muscle, the brachialis. Here's the brachioradialis. Okay, so the biceps also supinates. Okay, so the way to do a actual bicep curl is actually to bring it up, and as you bring it up, you supinate. Okay, that's how you actually exercise the bicep most efficiently. The other way of explaining that is you can either do a pull up this way or you can do a pull up this way. When you do a pull up this way, see how I'm completely pronated? I can't use my biceps now. So this is much harder to do than this, where I can supinate and I can bring in my biceps. Okay. All right. Next thing. Okay. The muscles of the forearm. Okay. The muscles of the forearm. Okay. So the movements of the wrist. Okay. Flexion, extension, abduction, adduction. Okay. All of those are controlled by the forearm. Okay. Okay. So flexors. Okay. The front of the forearm is the flexors. Okay. They're controlled by the median and ulnar nerve. Okay. So here. Okay. The first four you're responsible for. Okay. So pronator teres. Is here. Okay. It dives deep. It changes angles. That allows you to pronate the arm. Okay. All right. Now, the forearm. Okay. There are four muscles here that run basically parallel. And so you put your fingers across your forearm. You put 1, 2, 3, 4. This first one right there is going to be brachioradialis. The second one is going to be the flexor carpi radialis. Okay, you'll feel it. It's right. Your middle finger should be right about the radius. Okay, and you feel the muscle underneath. this middle one will go into the space between the two, okay? And that muscle is called the palmaris longus. If you look at the palmaris longus, it goes to the palm. It's the only one that passes through the wrist to the palm. Okay, here's the flexor carpi ulnaris. Okay, so these two are wrist flexors. The carpi ulnaris and radialis, these are going to be wrist flexors. Okay, the palmaris longus will control the palm. Okay, I want you guys to try to do something. Okay, so some of you guys are actually missing your palmaris longus. Okay, so I can. 1 second. Okay, I can do this. Okay, I can touch my thumb and pinky together, and I can flex. Okay, I can do that. And when you see that I have this tendon right here. You can see it very clearly, even in the crappy camera. Okay, that is the tendon for my palmaris longus. Now, I bet you, if some of you guys are doing this, you guys won't have a tendon here. Okay, so some of us are slowly losing that muscle because we no longer need it to like climb trees and stuff. Okay. All right. Okay. We'll skip the deep muscles of the forearm, extensors of the forearm. Okay. So let's talk about movements of the hand for a second. So most of the movements of the hand are generated by the muscles in the wrist. The small muscles of the hand are in the palm. Okay. Okay. So here, okay, you have two groups of muscles. If you feel your palm, you have one big group of muscles under the thumb. The other group of muscles is actually here, okay, on the pinky side, okay? So this group of muscles is called the thenar group. This group of muscles is called the hypothenar group, okay? So this one attacks, you'll see this, all of them have pollicis. Pollicis is the thumb, okay? And then the digiti, on the other side, you control the digiti minimi. Digiti, okay? Digit, mini, little finger, okay? All right. I'm gonna stop right here, actually. So there will be 3 parts to this.